You're watching Rogers TV, Barrie.
In progress.
Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. So to date, we've had 15,711 cases. This is up 505 cases since I reported a week ago. And so we've had increasing case counts week on week over the last 6 weeks, with a 20% increase last week compared with the week before. So during the week of November the 21st to the 27th, we had 497 cases versus 415 the week before. We have a total of 610 active cases. This is up from 522 a week ago. And we've had a total of 278 deaths to date. No additional deaths in the past week. At this point in time, 33 people from Simcoe Muskoka are in hospital with COVID-19, up from 25 a week ago, with 6 in the intensive care unit, unchanged from a week ago. Their ages range from in their 20s to their 90s, with 39% under the age of 60. Just asking if people can mute your line, please. Thank you. 30 are from Simcoe County, 3 from the District of Muskoka. 10 were community acquired, which means that we don't know how transmission occurred. 11 were close contacts of a known case. 5 were part of institutional outbreaks. 6 under investigation. 1 part of a congregate setting outbreak. 18 of these, making up 55%, were not vaccinated, including all of the cases in the intensive care unit. 9 cases were fully vaccinated and 6 were partially vaccinated. Today, over the last 24 hours, we've had 72 new cases of COVID-19. 71 of them are sporadic and 1 is part of a school outbreak. 41 are male and 31 are female. Their ages range from under 10 to in their 70s. 25% of them are children under the age of 12. 64 from Simcoe County and 8 from the District of Muskoka. With regards to acquisition, 44 are under investigation, 18 are close contacts of the case, 9 are part of, I beg your pardon, 9 are community acquired, meaning we don't know how they were acquired, and 1 is part of an educational facility outbreak. 68 are self-isolating and 4 have resolved. 28 are unimmunized, 5 partially immunized, 21 fully immunized, and 18 were not eligible to receive immunization until now. We note that we are vaccinating children 5 to 11 years of age now. Most of the cases, active cases, are located in the following municipalities: Barrie, Bradford, West Gwillimbury, Huntsville, Orillia, and Wasaga Beach. So in the week of November the 21st, both Huntsville and Wasaga Beach had the highest incidence of COVID-19, 160 cases per 100,000 population per week. Barrie had the second highest at 130 cases per 100,000 population per week, up from 125 last week, and Barrie has had an increasing incidence over the last 6 weeks, up from 25 cases per 100,000 population on the week of October the 10th. For all of Simcoe Muskoka, our incidence is now up to 82.5 cases per 100,000 population, compared with 69 cases per 100,000 population per week last week. The province's rate is 37 cases per 100,000 population per week, up from 31 a week ago. And this is the sixth week in a row in which Simcoe Muskoka's incidence has been higher than the provincial rate. And I note that in the previous waves, our incidence was typically much less than the province, in the range of half of the provincial rate. So during the fourth wave, it's been a very different situation for us compared with the province. 25% of our cases during the week of November the 21st were in children under the age of 12, and the majority of these were between the ages of 4 and 11, so school-aged, primary school. And their incidence was the highest of any age group at 161 cases per 100,000 population per week. So that's for children 0 to 11 years of age. We currently have 29 active outbreaks, up from 26 a week ago. We have 10 new outbreaks, one in a retirement home, the Waterford Retirement Home, with 2 cases. And the following elementary schools are newly declared over the last week as outbreak: Ferndale Woods Elementary School, St. John Vianney Elementary School, Monsignor Lee Elementary School, and Upter Grove Public School, and Our Lady of Grace Elementary School. And we have one secondary school declared an outbreak over the last week, Innisdale Secondary School, and a private school in Simcoe County declared an outbreak over the last week. We also have 2 community settings newly declared as outbreaks, both of them recreational facilities, one in Muskoka and one in Simcoe County. So another 19 outbreaks that are ongoing, and they are listed on our website, so I will leave that for your follow-up. And we have 6 outbreaks that have been declared over the last week. So 2 elementary school outbreaks declared over, Emma King Elementary School and Mount Public School, 2 secondary schools, St. Joan of Arc Secondary School and E.S. LeCarron Secondary School, and a community setting, a religious organization in Simcoe County declared over on November the 29th, and a congregate setting, a shelter in Simcoe County. With regards to immunization, we continue making progress with the last mile. So at this point, 88% of our population 12 years of age and older has received 1 dose, and 85% has received 2 doses, which is unchanged from the past week, although we have been giving vaccination, just not sufficient to move a full percentage point up. Our coverage continues to be lowest in males 18 to 29 years of age. There are currently 29,612 residents of Simcoe Muskoka have received 3rd doses of vaccine, and 4,324 children 5 to 11 years of age have received their pediatric dose of Pfizer vaccine, 1st dose, with a total of 1,129 vaccinated yesterday. And we have a total of 6,423 pediatric appointments that have been booked as well. So in the current week, 82% of our spots are booked, and just over half of our appointments are booked for next week. So we do have room for children and certainly parents looking for their children to attend and receive vaccine. And certainly I encourage all eligible to come forward and receive vaccine, considering that we are in a large surge in Simcoe Muskoka. It would be very wise to protect your children through vaccination. And we do have availability for all who would wish. When we look at our recent data, using the most recent 8 weeks of data, we find that those who are unvaccinated are 7 times more likely to become cases of COVID-19 compared with those who are fully vaccinated. And they are 13 times more likely to be hospitalized compared with those who are fully vaccinated. During the week of November the 21st, 37% of our cases occurred among fully vaccinated individuals, the remainder occurring among those who are unvaccinated or partially vaccinated. When we look at our dashboard, we are in red category, as we've been for a while now. And in red designation with regards to viral spread and containment, rate of transmission being up, the reproduction number at 1.2, so anything above 1 means growth in the pandemic. Laboratory testing is in yellow status because of the high percent positivity at 4.2, and basically anything above 3 is of concern. This is a measure of both the amount of transmission happening, but also the sufficiency of volume of testing being done. But we are seeing a continuation of very good turnaround times for laboratory test results, 92% being returned within a day. Our health system capacity is in yellow status with a higher degree of acute bed occupancy, primarily unrelated to COVID-19. And our public health system remains in red status with a delay in our ability to get to people who are cases. We are reaching 65.7% of our cases within a day, and our goal is better than 90%. When we look at our outbreaks, something of note with regards to the outbreaks, we have a very high number of them at this time. As I've indicated before, 29 confirmed outbreaks, up from 26 last week. The last time we had this many outbreaks was at the height of the 3rd wave. The majority of these outbreaks, 72%, involve populations that haven't been eligible until very recently to receive vaccination. So 20 elementary schools and 1 private school are an outbreak. We also note outbreaks in vulnerable settings, so 2 community shelters and 1 retirement home. And we also have had outbreaks in 2 community settings, fitness and recreational facilities, and 2 secondary schools. If we consider how we compare right now with other health units, we note the following conclusions. First off, we are outliers compared with the health units in the Greater Toronto Area. So our rate of transmission is much higher than the other health units in the Greater Toronto Area. And this is very much contrary to the pattern that had been in place for the previous waves. So the previous waves, we had an incidence about half of the provinces and about a quarter of the health units in the Greater Toronto Area. And now instead, we're much higher than these other health units. Our incidence is 82.5 cases per 100,000 population. And all of the other health units in the Greater Toronto Area are below 40 cases per 100,000 population. Although there is some increase in the GTA, they did experience a 32% increase in their incidents over the past week, most notably in Halton and York region. When we look across the province, there are other health units that are like us in full surge, but they are elsewhere in the province, not in the large metropolitan areas. So overall, we are the 8th highest incidence per 100,000 population per week compared with other health units across the province. And the following health units have higher incidence than us. Temiskaming at 202 cases per 100,000 population per week, Algoma at 175, Windsor Essex at 109, Sudbury at 104, Kingston, Frontenac, Lennox, and Addington at 102, Haldimand, Norfolk at 82, and Southwestern Health Unit at 87. And by way of comparison, Toronto has an incidence of 22 cases per 100,000 population, but because they are a much larger community than us, they actually have a higher number of cases. But there have been times in which we've had the second highest number of cases overall because of the combination of our relatively large size and our quite high incidence per 100,000 population per week. When we look at our populations, we note the following. The highest percent positivity is noted in young adults, those 18 to 34 years of age, at 5.7%. The District of Muskoka has a higher percent positivity than Simcoe County and the province for the past 2 weeks at 5.2%. The age group of 0 to 11 has the highest incidence. Since mid-September, that's been the case. And during the week of October the 24th, it had experienced an increase of 192%, going from 55 cases per 100,000 population. Or I should say, since the week of October the 22nd, they've had an increase of 193%, going from 55 cases per 100,000 population to 161 cases per 100,000 population in the past week. And the next highest age group are youth. So those 11 to 17 years of age have a weekly incidence of 82 cases per 100,000 population per week. At this point in time, and actually for some time now, we've been limited in our ability to follow up with outbreaks and cases due to resource limitations and the very intense degree of transmission that's happening here. And so we've had to prioritize for keeping schools open, focusing on follow-up with cases in schools and outbreaks in schools, and otherwise focusing on vulnerable populations such as in congregate settings. So we do note that there have been other locations in the community where there have been clusters of cases, 2 or more cases, and we have not been able to ascertain and assess which of these would actually be outbreaks with on-site transmission. But it's important to be aware of these locations. They could very well be outbreaks. People need to be aware of the fact that this is happening. And so we note a significant number of workplaces, multi-unit dwellings, a place of worship, food premises, recreational facilities, hotels or short-term rental locations that have had clusters of cases. As I've indicated before, about a third of our cases that are community, actually I haven't indicated this before, when we look at our community cases where we haven't been able to identify where transmission had taken place, 33% of them are children under the age of 12 that have been so affected. Okay, so on Friday, the World Health Organization declared a new variant of concern and named it Omicron. And This has been noted to be a variant of concern because some indication that it may be significantly more transmissible than other variants. Based on the experience of where it was first identified in South Africa, where they are now in elevated transmission. And in reviewing the viral characteristics, the genome of this new variant, they do note a substantial number of mutations of concern, in particular on the spike protein, some 32 mutations, some previously identified, others new, some of them associated with increased transmissibility or the potential for reinfection. The world has been very much put on alert with this announcement, including here in Canada, a total of 10 countries in Africa have been identified by the federal government as being barred from flights from these countries to Canada, and Canadian nationals arriving from these countries are to go into quarantine and have enhanced follow-up and testing for COVID-19. All test results for COVID-19 in the province of Ontario are genomically sequenced in order to identify whether or not they are this new variant. So far, 4 of the Omicron variant have been identified in individuals in the province, all of them in Ottawa, all of them travel related as reported by the media and under quarantine and follow-up. And across the country, there have been a total of 7 cases. At least by the time of the beginning of my press conference today, 7 that have been announced. So others located in other provinces. And the Public Health Agency of Canada has identified all individuals that have come from these countries of concern over the last 14 days and are contacting these individuals to ensure that they are in quarantine and assess for any further follow-up that's needed. So to date, just to be very clear, we have had no identified cases of Omicron within Simcoe, Muskoka, and certainly if and when that happens, we will communicate promptly this to the public. We note that there's much to be learned about this variant, that we don't yet know the degree to which it may be more transmissible, the degree to which it may have the potential to reinfect people who've been infected before, the degree to which it may be less responsive to vaccine. We don't know whether it is or isn't yet. And we await further research to answer these very important questions. We don't know whether or not it causes more severe disease. So these are all unknowns, very much under investigation right now internationally. And as that information becomes clear, it will be communicated to the public, and it will, I think, be important information for us as we manage on an ongoing basis COVID-19 and manage the potential for this variant to become more established and potentially circulating in this province. But we do have, it's fair to say, a very robust surveillance system in place with the testing that's taking place and the whole genome sequencing that's taking place for all positive results for COVID-19. In the meantime, it's very important that people continue with the measures that are in place. And the single most important one, as I always say, is vaccination. For people to get their first and second dose, all who are eligible. And this now very much includes children 5 years of age and above. And for those who are eligible to receive their booster shot, that we strongly advise that you receive that as well to ensure the highest degree of protection. And beyond this, the other standard measures that people need to continue to abide by: vaccination with the Delta variant, is very important, very effective, but people need to continue with the other measures as well. And I would position that the same is true with Omicron. So this includes the use of masks in indoor public settings and work settings and outdoors when unable to distance from other people, to be physically distanced 2 meters from other people, particularly indoors, to self-monitor and isolate and seek testing if you develop any symptoms. The same for your children, not sending them to school if they have any symptoms of illness. And practice good hand hygiene. I've more recently been advising people to reduce your social circle, pick a smaller group of individuals that you're dedicated to without changing who they are over time. I'm also advising that employers and agencies take real care when it comes to the socializing that can happen associated with work at this time. And it's very much advisable that you do that remotely rather than in person, because we have seen the potential for transmission via that means. So all of these things are important with Delta, and they are important with Omicron variant. I've already spoken with regards to the vaccination of, in general, and with regards to children 5 to 11 years of age. So we are having a fairly robust response of people coming forward to receive vaccination, but there's lots of room, and we would like to offer this to all children. And certainly would want and take full advantage of the booking they can have through our the provincial booking system into our clinics. And people also have the option of vaccination at participating pharmacies. And there's a link on our website that would take you to which pharmacies are participating, as well as the Ontario GoVax bus when booked to be here. And some primary care practitioners are also participating in this. A little bit of information about the vaccine from the clinical trials that were submitted. Its effectiveness is 91%, so prevents 91% of COVID cases that would have otherwise occurred, and has been demonstrated to be safe. And in the United States, over 4 million children so far have been vaccinated against COVID-19 without the identification of severe outcomes. So certainly it's a safe and a highly effective vaccine. And at this time that we're having a surge in our community, it is the most important thing you can do to protect your child against COVID-19, and also considering all the outbreaks that have been occurring. It's important to do so. It's also important that those who are eligible to receive their booster shot, their third dose, do so. And once again, people will be able to look at our website about the eligibility and to book on the provincial portal in order to be able to receive vaccine, or check with their pharmacy. Right now, as a Health Unit, we're concentrating on the vaccination of the children 5 to 11 and their family members and first and second doses. So for those seeking third doses, booster doses, we would ask that you seek that at this time through participating pharmacies, the GoVax bus, and through some primary care providers who are participating. With regards to the outbreaks, as I've indicated, we have a very large number of them, and we are limited in our ability to be able to get to some of the clusters that have been happening in the community. So we do advise that businesses have a look at the information that we have on our website about what to do to safeguard your business, your work environment when you have cases of COVID-19, to help assist you with that. We do have one school closure, that is Spruce, Glen Public School in Huntsville. At this time, we've had 24 laboratory confirmed cases. That's up noted on our website, but also an additional case that's out of jurisdiction, therefore not on our website. And we've temporarily closed the school because of over half of the classroom cohorts being impacted by this outbreak. So just the size of it has made it difficult for the school to function. And so this is the first time we've actually had to close a school in the pandemic ourselves. Certainly the province has, throughout the pandemic on a number of occasions, had all schools go to remote learning. This is the first time that we've had to do it for a single school. And we are advising certainly follow-up and testing and quarantine for the cases, for their contacts, for other child members of the households that are affected. And we are recommending that for all others at this school that they receive testing with a PCR test. And we are facilitating that taking place, and all attendants at the school are receiving communication to that end. Aurelia Soldiers Memorial Hospital has just made an announcement by the media that they are in outbreak, that they, in consultation with the health unit, have declared an outbreak on the Soldiers 1 medical unit. This has involved 4 patients who tested positive on that unit. They are, at this time, closed to visitors on and new admissions on that unit. None of the staff, all the staff have been tested. None of them have been positive. They've all been negative with regards to their tests. Soldiers Memorial has a very stringent staff vaccination policy requiring immunization for their staff. And they are exercising their mandatory visitor vaccination policy that was put in place earlier this month, and will be further restricting visitors with regards to access to other locations in the hospital until further notice, effective December the 2nd. With our very high transmission rate and a rapidly increasing transmission rate, and with some increase in hospitalization, I'm becoming very concerned about the trajectory of things and where we are headed. I note other health units across the province that are in similar circumstances, and in particular, the 3 health units in the north with the highest incidence of COVID-19 have, in response to their situation, put in place the capacity limits for facilities and businesses that had been lifted through the month of October. So we've put in place 2 letters of instruction, one with enhanced protective measures for workplaces and businesses about the requirement for mask use and screening for symptomatology for those that are attending, and documenting the contact information for those in attendance. And we have a letter of instruction that requires proof of vaccination for youth 12 to 17 years of age participating in organized sporting activities indoors in non-school settings to be phased in with the dates required for youth to be able to comply with that. And we do have our revised order under the Health Protection and Promotion Act requiring quarantining for unvaccinated children who have a household member unvaccinated who is a contact of a case, to get ahead of, as much as we can, transmission, exposures, and outbreaks in elementary schools. So we have all of that in place, but we need to consider what else could come, and consider the kind of action that other health units have taken when they've had considerably higher transmission rates, so quite a bit higher than we have now. And I've already identified that in the north, the three health units in the north, Temiskaming, Sudbury, and Algoma, have put in place the capacity limits for businesses and facilities as a strategy. This is not something that I'm intending to do immediately. It's something that I'm looking at if it proves to be necessary, depending on the trajectory of our cases. But it's something that I want the community to be aware of. We are going to be issuing an open letter to businesses and to the community, identifying the situation we're in, the trajectory that we're headed on, and the need for all of us now to really abide by the public health measures, the content within my letters of instruction for workplaces and businesses, to try and avoid that kind of action. I have had verbal communication with political leadership throughout Simcoe Muskoka, and I'm starting to engage the business community as well. So that open letter will be distributed to the business community, to employers, to our municipalities. We intend to get that out by early next week, if not sooner. So I note the following questions from social media. You have told us to get vaccinated so we can get back to the things we love. When do we get that? And when can we stop wearing masks? If COVID is something we're going to have to live with, when can we start living? So certainly I sympathize with the desire to go back to the lives that we had before this pandemic. And this has been a very long time. We're coming towards the end of 2 years, and we'll soon be entering a third year of this pandemic. That's a very long time. Very trying, very exhausting, has had impacts on people's lives and the quality of their lives and their ability to socialize and be close to the ones we love and to do the activities that we love and just be together. And in addition to impacting people's livelihood and ability to make a living. Of course, the disease itself directly impacting on so many people, the 15,000 cases that we've documented, the over 200 deaths that we've had, and many people that were severely ill and survived. So I sympathize with this sentiment. Unfortunately, pandemics can go on a long time. And this is the pandemic of the century. We really have to go back to the Spanish flu of 1918 to have this an experience of a similar magnitude. And by all accounts, when we look at the transmission pattern around the world, it doesn't appear to be slowing in most places in the world. It continues in most places in the world. In Ontario, we've actually managed to do quite a good job with the fourth wave of controlling this Delta wave that in other places in Europe and Western Canada completely took off. And we did that through a high vaccination and through continuation of public health measures, a very measured reopening of things. And unfortunately, we have no choice but to continue to be cautious. The COVID-19 virus has demonstrated its ability to mutate and form new variants that can be a challenge to us as well, become more infectious or more severe. And now we have a new variant that we need to manage, need to learn what it's all about and manage it. So despite the fatigue that we have and the difficulty that we've had with all of this, we still are faced with this tremendous task before us. I do not know when and in what way we would get back to a more normal existence. I think we need to take it in measured steps going forward. I do not have the answer to that question, I am afraid. And of course, we want to live as normally as we can. And I think it would be important to note how safest to do that. And doing things outdoors is the safest way to do that. And sticking to smaller groups, dedicated people, is a safer way to do that when you're indoors. And sticking by the measures, getting vaccinated absolutely is the single most important thing you do. But otherwise, sticking with the masking and the distancing when you're in those public spaces, being careful at work as an employer, being careful. We are going to have to continue with those things if we're going to be safe. Another question, I'm hoping Dr. Gardner could address the severity, sickness of COVID-19 cases in Simcoe, Muskoka, and if he is concerned about local health care's ability to respond. So I have started all the way along, monitor the data about transmission, and we do have quite a high surge in transmission. The hospitalization has gone up a bit, not a lot so far, but we do need to monitor that very closely. That is the indicator that I use for severity, is if somebody is hospitalized, and in particular in the intensive care unit. And so that is an important indicator as well for us. But it lags. You're going to get the transmission in cases showing up before you see it rise in hospitalization. So we need to be careful about relying too much on hospitalization. I maintain communication with those who are leaders in the hospitals in Simcoe, Muskoka, and now I think more and more on a regular basis we'll be touching bases, not just with the numbers, but asking them how they're finding things, what are their issues, to get a more tangible sense as to how this is playing out from a severity perspective. The age of these cases has been younger on average than it had been in the previous waves, and that's because older people have a higher rate of vaccination. Older population here has had a much higher vaccination coverage. They have better protection. And so we're more vulnerable with the younger populations. Certainly those under 12 years of age have only just become eligible, 5 to 11, to receive vaccination. And I urge everybody to come forward and get vaccinated to help stem the tide of cases among the younger population as well. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Sean Gibson from Barrie Today? Do you have a question?
Hi, yes, thank you. Can you hear me?
I can.
Okay, perfect. Just checking into the church situation, because there was some confusion earlier yesterday from it. So the church was declared, their outbreak was over on Monday, which I believe we as media found out later Monday. I don't know, it looked like it was later it was announced. But the Sunday services started the day before, and their pastor said that they were given permission, or at least had the blessing of the health unit. I think people are concerned with all this talk of concern of variants and high numbers, why the church was given the okay to run while in outbreak. Why not just say, guys, can you wait one more week?
I think that's a fair question. In speaking with my staff about it, they state that the approach that we take with a facility that's in the community would be less stringent than it would be in an indoor congregate setting or in a healthcare setting where the people are more vulnerable. You can isolate away from the community setting like a church those that are cases that are still waiting to pass their 10-day period of communicability. And so it would be a judgment call on the part of my staff, whether or not they felt that things were coming under control, that there hadn't been more recent transmission, that they'd identified everybody who was at high risk as a case or contact and put them in isolation, and therefore would be able to allow the church to proceed.
Okay, and I don't know how much you're gonna be able to say to this, and I know I've mentioned this before, And not trying to pick on the facility, but I think a lot of people are confused as to why a facility who on live video mocked the health rules, mocked the bylaw rules and the health unit were given permission to run. I think that's a sticking point, is that it's not like it was an accident, and these things happen. I mean, a lot of organizations are going through it, and it's going to happen. We get it. But when it's mocked on video, then I think people are confused and think there's special treatment, and not that you're giving special treatment or that the health unit is, but something's wrong, and people are upset.
Well, we certainly, when dealing with outbreaks of this nature, make it very clear what's required to be able to open up, and what's required for them to operate safely, and what their responsibilities are, and what the consequences would be if they aren't abided by. And I can assure you that although I don't want to speak about individual situations, we require all of that before a facility would be able to open up again. Regardless of their history or what had happened in the past, that is what we'd be looking for. And certainly this facility, like all faith-based services, received our new letter of instruction, and in addition to that, a letter specifically to faith organizations, making it clear what the expectations are of them. And they certainly include the requirement for mask use indoors, and that the operator of the service is required to enforce such, and also the active screening of individuals coming to the premises for symptoms and exclusion if they have them, and the logging of contact information for those that were attendants, as well as all other measures that are required for sanitation. So I can assure you that that is required now of these premises, and certainly any that are in outbreak before they get open again.
Thank you.
You're welcome.
We have a question from the chat function from Mo Fahim from My Muskoka Now. He asks, the District of Muskoka is seeing a surge in cases, specifically Huntsville, in the past week or so. Do you think that there is any main type of behavior that is leading to such a localized jump in cases? And how do you advise residents of Huntsville and Muskoka go about December, keeping in mind the colder weather and holiday season's tendency to push more people indoors?
I believe that Muskoka is in a similar situation to Simcoe County. Now, throughout most of the pandemic, the transmission rate in Muskoka had been considerably less than Simcoe, and in particular South Simcoe and Barrie, but that is now no longer the case. Just like all of Simcoe, Muskoka finds itself with a much higher transmission rate than the Greater Toronto Area now. Muskoka now has a similar rate of transmission to Simcoe County, and in fact, last week was higher. And it's the same kind of pattern. It's younger people; those are too young until recently to get vaccinated that are predominating. We've seen primary school outbreaks, and among elsewhere in the population, we have a range of community settings that have been impacted, including food premises and multi-unit dwellings and other businesses. And when we look at the population as a whole, it's primarily younger people that are most affected by this. So if not children, then youth and young adults. And this would be in keeping with their level of vaccination coverage. So the key thing would be for those who are not immunized to come forward and get immunized. We're in surge. This is the single most important thing you can do to protect yourself and those around you. And parents, this is a very important thing that you can do to protect your child 5 to 11 years of age. And in addition to that, we all need to abide by the public health measures at work or in the community. Otherwise, mask use, physical distancing, self-exclusion, and testing if you develop symptoms, or if your child does, not sending them to school. All of that's really important. And I also advise that people reduce their social circle and have a dedicated small group at this time.
Thank you. Can we go with Erica Engel from Collingwood today? Do you have a question?
Hi, yes, I do. First, I just wanted to check in to see if you got the total number of deaths of fully vaccinated people.
I will pursue that.
Okay.
I did ask. I will get it for you. I promise.
Okay, thank you. And then you probably saw Dr. Moore talk about pursuing other options for like a different vaccine that's not mRNA or a viral vector, and also treatment options as a way to address the people who still haven't gotten vaccinated because of hesitation. Do you see that as something that would be helpful in the region based on the feedback that you're getting?
Having other options is always a good thing, certainly about vaccination. We have superb vaccines, but if there's a segment of the population that would prefer, say, Novavax as a new vaccine coming, or J&J, Johnson & Johnson vaccine, if that can help get them to receive vaccine, that would be a good thing. When it comes to treatment, with the new antivirals that are still awaiting Health Canada approval, they sound promising, though I think we need more information to corroborate that. But treatment is never really inherently as good as prevention in the first place. So they are useful if you develop symptoms. That you, if you're able to access them right away, can greatly reduce the likelihood of being hospitalized. But the problem there is you're waiting until you've contracted the infection, and then it would be a race against time to be able to be diagnosed and get the treatment. And at this point in time, we're still awaiting Health Canada approval for these treatments. So these are things, I would say these are things to come, and they're still of secondary value and importance compared with primary prevention through immunization and through the other public health measures that I always reinforce.
Okay, and then just going back to Omicron, most of the conversation is around federal regulations requiring testing coming in. And apologies, this is a little bit outside of your scope as a regional medical officer of health, but in Simcoe Muskoka at the very beginning, we had these problems with like people coming from outside the region that were in higher COVID areas. And then when you were studying socioeconomic impacts, it was like lower vaccination rates or higher COVID rates in poorer areas. So now we're seeing the exact same thing on a global scale because it is a global pandemic.
Yeah.
So I don't know if maybe you want to just make a comment on, if the rest of the world doesn't get vaccinated on the same rates that Canada and Ontario is, is this just going to be, are we going to run out of Greek letters?
That's an entirely apt question. And I note that the world as a whole is not getting this under control, that transmission is as high as it's ever been. And now we have a new variant and we shall see what it does. But even places that have relatively high vaccination, such as Europe, have had trouble controlling the Delta variant. This just speaks to how very transmissible COVID-19 is and its variants are. So undoubtedly, we will need to rally internationally to provide vaccination to the entire world to help bring this under control. And even then, we're going to have to be cautious with the other measures, at least to some degree for the foreseeable future, because it's just so transmissible. So I don't doubt the importance of the international effort. And while we have large numbers of cases around the world, we will persist in the potential to develop new variants of concern.
Thank you very much.
You're welcome.
James Bowler from Cogeco, do you have a question today? Okay, can we go over to Chris Simon from the Barrie Advance? Do you have a question today?
As always, hi, Dr. Gardner. You've mentioned that there are a number of facilities, businesses that have clusters of cases, but you haven't been able to, due to resources, check them out. Do you have an idea, an approximate number on how many of those facilities you're unable to get to at the moment?
Yes. Let me just turn to my notes about that. All right, here we go. For the week of November 21st to 27th, we've had 36 exposure sites with 2 or more cases in the community. And so they break down, 72% were in Simcoe County, 28% in Muskoka, 13 work sites, 4 multi-unit dwellings, 1 place of worship, 10 food premises, 5 recreational facilities, 3 hotel or short-term rental locations.
And so those are facilities that you have not been able to confirm outbreak status in, correct?
That's right. That's right. They have 2 or more cases, and due to our own limitations, we've been unable to determine whether or not they're actually outbreaks.
Okay.
To be sure, every one of those cases has been contacted, and the majority of them, their contacts would have been contacted and advised about what to do on an individual level, but it takes a greater degree of resources to do the kind of investigative work to see if transmission happened at those sites, thus declaring them outbreaks.
Well, and if an outbreak were declared as well, then there would be more protocols and such in place, right? To
That's right.
curb the spread. If I can ask one more question, is there anything that you would like to see the province do in terms of additional measures at this time? It's one thing for the health unit to do it, but I think we all know that it comes with an extra little bit of emphasis when the province steps up and takes action.
So they are providing us with a provincial workforce. So we are able to provide to their provincial workforce a significant number of our cases and their contacts for follow-up, the more straightforward cases. So that helps us tremendously. And we did get with our confirmation letter from the province of funding for the remainder of the year, indicating that we would get the money we would need to cover our expenses and now into the end of the year. The assurance that in 2022, they would cover COVID-related costs. So with that assurance, we're able to build a budget for 2022 that would give us the resources we need and have stability through the year to be able to do the case and contact management, the outbreak response, and the immunization that we need to do, and enforcement and communication as well. And we received support from our Board of Health at their November meeting to commence hiring. So we are underway with hiring to build up our team again to the level that we would need for that kind of stability. So those are 2 things that are important from the province. One, the provincial workforce, the other, the assurance funding for the year. And we also, because of the support of our municipalities, have access to lines of credit if that becomes necessary as well. And with the provincial funding that they've now given us for the remainder of the year, we will probably be able to reestablish our reserve funds to give us a cushion with regards to a resource draw as well. So we're in a building phase right now.
Thank you.
You're welcome.
Can we go with Mark Bruneman from Barrie Today? Do you have a question? Sorry, Mark, we're unable to hear you. It's just a lot of feedback. Christina, are we able to mute her? Thank you. Mark, we'll try again. No, we can't. There's just a lot of feedback, Mark. We'll come back to you if you're able to get another connection.
Perhaps a text question.
Absolutely. Mark, feel free to put your question in the text box and I can answer it. We can answer it that way. Can we go over to Mike Arcelides from CTV Barrie? Do you have a question today?
Yeah, I think Mark did leave some questions up there anyway. So if you want, I can hijack it right now and then we can get to Mark. So doctor, can I ask you, do you envision a similar scenario to what we saw coming out of the Christmas break last year and kids not returning to school if we see a big explosion here?
That's not our plan. We've prioritized for the mental and physical well-being and education of our children and youth in-class, in-person education, and we're doing all that we can to avoid school closures. And so it's not our plan that we would extend the vacation. I can't guarantee that that won't happen with a potentially a provincial decision, but that's not our plan at this time.
And with regard,
we are interested in additional measures such as enhanced testing protocols in schools to help keep them open, in particular when they return.
Yeah, so to what extent are those kits, or have they been received? I understand the public board has a ratio of about 10% of the student population getting kits sent home. What do you envision as the compliance here?
I think that'll be hard to say. We don't have experience with it, so we need to see. We, in some of the previous outbreaks, one in particular, when we made testing available for everybody who wasn't directly affected by the outbreak, we actually had a low uptake. So it may be low. We shall see.
The question I have to ask here is, how are people getting sick? Is it that interplay still between leaving school where you're masked and you're following all the protocols to going home and letting all heck break loose?
A good portion of it would be happening out in the community. Like a third of it, for example, would be among children is happening out in the community without an identified source, or in the home is another. They, have extracurricular activities that they can be participating in, and we've seen some transmission in other community settings like that, recreational facilities. But for sure, some of the transmission is happening in the schools themselves, which is part of the definition of a school outbreak, that there is transmission at the site.
Okay, so the question is, how are people getting infected, essentially? Is this unvaccinated folks spreading it, or is this simply the way it is traveling and infecting people in any setting possible?
Most of our cases are unvaccinated people, and certainly with children under the age of 12. Only now do they have the opportunity to get vaccinated, so most of them are not, by far most of them are not vaccinated. And I'm hopeful that we'll have a good uptake of vaccination among children 5 to 11 years of age, and that will have a significant impact on transmission in that age group and in schools. And then we are seeing transmission among primarily unvaccinated youth and young adults as well as the major driver of what's happening. And it's occurring in the household, but also in various community settings. I note the locations of the clusters that I've cited before, including food premises and multi-unit dwellings and recreational facilities, and some community settings such as in religious service locations. So there are many community exposure sites where people have unfortunately had the opportunity, those who are vulnerable, in particular those who are vaccinated, to get infected. So my main message is to obtain vaccination. We are in surge now, and this is the single most important thing that people can do to protect themselves and what parents can do to protect their children. And then beyond that, people need to abide by the other measures. Vaccination is the most important thing, but by itself not enough. You also need to continue with mask use and distancing in indoor public places and workplaces, and monitoring and self-exclusion and testing for yourself or your child if you develop symptoms.
Thank you.
You're welcome.
So Mark Bruneman has dropped her question in the text box. So she asks, would you be able to comment on SMDHU's ICU capacity?
At this point in time, we haven't had an increase in the ICU cases. I believe earlier I said it was 6 of our cases are in the intensive care unit, or COVID cases. And so that in itself is not going to be a substantial impact overall in capacity, but there may be other care-related matters contributing to the use of the intensive care unit at this time that I'm not aware of.
And she also asks if you could expand on increased communication with hospitals.
I've had email communication with some hospital leadership, and I intend to continue that. In the past, I've had teleconference meetings with the leadership of hospitals, which is something I think that I will start again, just to keep a better connection on what's happening. I am very active with the Central Region of Ontario Health on their weekly table meetings on Mondays, which has hospital leadership and other sectors in attendance. And I always give a public health update at that venue as to what's happening in the entire central region for Ontario. So that's another opportunity for me to get a sense as to what's happening. Also, of course, is us monitoring the data, the proportion of the number of our cases, the number of cases in Simcoe Muskoka that are hospitalized.
Okay. Thank you, Dr. Gardner. And can we go over to Mark Claremont from Muskoka today? Do you have a question?
Yes, regarding Omicron, is there any indication that the current vaccine is effective against what will be the next variant?
We don't know at this time definitively how responsive this new variant would be to the vaccine. And I think we need to await research in order to answer that question. But I advise that people be immunized and get third doses when you're eligible, for all who are eligible to receive first and second doses to do so now. We are in full surge with regards to the Delta variant, and in all likelihood, there would be at least some responsiveness, possibly very good effectiveness against Omicron as well.
Also, thank you. Also, somebody asked me that they went to the movie theater recently, and they've got signage that says that it's safe to remove your mask once you're in your seat. Is that just plain wrong?
Yes, people need to be maintaining their masks.
Okay.
The environment in which you're allowed to remove your mask is if you're eating. So, if they're, people can buy refreshments, and so they are allowed to remove their mask while they're eating. So that, of course, would apply to restaurants as well.
Okay, thank you very much, sir.
You're welcome.
Are there any questions from the phone line this afternoon? Okay. And is there anyone that didn't have the opportunity to ask their question this afternoon?
Yeah, that would be me, Kara.
Oh, hi, Mary Beth. Go ahead.
Hi. I just wanted to talk to you about Spruce Glen Public School again very briefly. I know you kind of went into it in a bit of detail, but how tough is that decision to close a school? Because I know that you've been really fighting to keep schools open.
It's something we reluctantly do. We've only done it once. And in this case, you had over half of the school cohorts that were affected. So it becomes hard for the school to operate when you're down to that level. So we don't do it lightly.
Mm-hmm. And was this a decision that you obviously made with the Trillium Lakes District School Board?
Yes.
Okay. Okay, perfect. Thank you.
You're welcome.
I believe that brings us to the end of our media briefing today. Thank you, everyone, for your participation. And Dr. Gardner, thank you so much for your update. Our next media briefing will be Wednesday, December 8th. Thank you so much.
Goodbye, everybody.
Recording stopped.
And I was like, yeah, it's going. I'm still doing lots of stuff, but I wasn't really getting anywhere with it, right? And he was like, I thought I would have seen you in Nashville by now. And I was like, oh, ouch. No, but yeah, and then he was like, I actually have a friend because he travels for work. So he had a buddy in Nashville. And he calls him up. We were sitting at the table. He calls him up right there, puts him on speakerphone, and he's like, hey, do you know anyone? And I have my young cousin here. And the guy's like, yeah, I know someone. And anyway, so yeah, that was kind of it. So we, I think he knew like someone at really high up in at EMI Records in Nashville. So
Nice.
So it was a huge connection. And anyway, so yeah, I was kind of like back and forth with this cousin of mine trying to figure this out. And anyway, so that was kind of what drove the start to making a portfolio, like an actual professional portfolio, because I had nothing to share with these people, right? So anyway, then a year later, finally sending them my stuff. So I haven't heard anything back yet, but we're gonna see how it goes.
Awesome.
Yeah.
So you also did some recording in town as well, I believe, or had some mastering done here with a local.
Yeah, so I worked with a local producer named Jeff Wardle, and he was great throughout the whole process. It was kind of a new experience for both of us, just because of working through COVID, and we had to do a lot of it remotely, like I mentioned before, and over text and stuff. So yeah, it was very interesting. But he was super, super good throughout the whole thing, and being understanding of my being new at this too. And anyway, so he absolutely blew it out of the park, and far exceeded any of my expectations for the EP. So he was great, and he was great help. And then when it came down to mastering, he knew a guy named Noah Mintz from Lacquer Channel Mastering, and so I actually never met Noah in real life. We had kind of only talked virtually, but he did the work and sent it back, and first try I was like, perfect. So nice. Yeah, it was a kind of an easy super, super fun.